With our population living longer than ever before, more and more elderly people are being treated for behavioral issues across the country. Aging brings on many challenges. Decreased physical and mental capabilities, the loss of loved ones, and reduced independence can often mean significant changes in the lives of older adults. A sudden or prolonged change of behavior or mood may indicate a presence of mental illness. If this occurs, specialized care may be needed, and many experts feel our current healthcare model is in dire need of a fresh approach to treatment.
The most common have a dementia, but the dementia has to be associated with a psychiatric diagnosis as well. So associated with that, the most common is probably a psychosis or a paranoid psychosis. Psychosis just means loss of touch with reality. These folks become paranoid. Some hallucinate. Probably the next would be depressions, some anxiety disorders as well. So those are probably the largest areas that we would hit. It is important that we make them feel comfortable in a home-like environment and not try to be real institutional or dogmatic with them and use the art of redirect.
With strong clinical programs and proven results, Haven Behavioral Hospital accomplishes its mission of bringing quality care to the geriatric population within the communities they serve. Haven delivers the highest quality behavioral health care to its patients in concert with their families, while offering outstanding communication and collaboration with its referral sources and the community.
Haven is founded on the principle of being a specialty behavioral health care. We have a variety of different lines, geriatric being one. We certainly look at expanding the geriatric services we offer. We're always looking for communities and host hospitals that would be good partners for us to work with. We think there's quite a need for expanding the services as you look at the demographics, the specific needs of the elderly, and the expertise that we've developed in it.
This is the Haven Behavioral Hospital of Eastern Pennsylvania, conveniently located on the third floor of St. Joseph's Medical Center in downtown Reading, Pennsylvania. Its team of skilled healthcare professionals provides inpatient acute care treatment programs designed for adults in a warm, safe, and caring environment.
We think about the whole person. What are the physical needs the person has? What are the emotional issues that are person's being challenged by? What are the intellectual challenges? So our modalities and our whole treatment approach is directed toward that. We're looking at what are the hopes and dreams of this person, how do we help them get back to either some way of living that was satisfying to them or to face the next challenges they have so they have a good, satisfying life.
Haven's adult and older adult programs provide inpatient psychiatric stabilization and treatment for those experiencing acute symptoms of depression, anxiety, mood swings, or psychosis.
The family is a very important part of the treatment and discharge plan of the geriatric patients. They need very close support in monitoring. So when the patients arrived, we try to contact the family to get quality information, to find out how is the activity or daily livings of the patients and what kind of services they need. Also we have a family meeting during the treatment and discuss discharge planning, what is the best options for patients to go back to community to stay with the family, or if the patient is difficulty to go to his or her baseline to be placed to a specialized nursing facility.
Haven Behavioral's comprehensive services are provided by a tailor-made treatment team consisting of psychiatrists, registered nurses, licensed social workers, clinical therapists, and mental health technicians. This treatment protocol is designed to encourage the patient to learn coping skills and develop a healthy social support network so they can manage their mental illness and return to their best possible level of health.
We have therapists who are here, and their role is to design a treatment plan with a patient that will address their emotional needs. We have the nurses here 24 hours a day who are there to care for the patients, help them with medications, their physical difficulties if they have some in caring for themselves.
I bring to Haven Behavioral my experience as a family physicians, and also my experience working as geriatric psychiatrist in Bellevue Hospital with medically compromised patients and geriatric patients. So I emphasize not only the psychiatric problems and also in the medical problems. Frequently, the psychiatric geriatric patients, they have medical comorbidity, which needs to be addressed and which they can worsening their symptoms. So our care here is comprehensive, coordinated between me and the primary care physicians, addressing their medical and psychiatric problems together.
The Haven Behavioral Acute Partial Hospital Program is another important part of the continuum of care. The partial program helps patients safely manage their psychiatric problems on an outpatient basis.
It's a way to have the patients be able to spend a significant amount of time during the week, 5 or 6 hours a day, 5 days a week, and be able to take what they've learned at the inpatient unit, start to implement that in their life, have the support of the physician who still sees them there regularly, work with the therapist, and really then transition back into their regular community life.
With strong clinical programs and proven results, Haven Behavioral Healthcare accomplishes its mission of bringing quality care to the geriatric population within the communities they serve in a safe, compassionate environment.
Haven does a lot of educational outreach in the form of lecture series, in services to different agencies. And that not only is that those agencies are hungry for that, but I think there's a great openness to that now, both in the lay community and families wanting to be part of education.
The ultimate goal is trying to improve their quality of life. Obviously, if they're paranoid and striking out, that's not a good quality of life, but also to return them to the point of origin, which for the most part are the nursing homes and the assisted livings.
The thing, though, that I feel the best about and that keeps me going is the fact that we're meeting the needs of an Edmond population and addressing both the physical issues with the host hospital services as well as the particular and specific mental health needs that Haven can provide. It really feels good to see patients gain back some of the independence that had been written off because they're getting old.
There has been quite a big shift since I started practice 25 years ago about the benefits of mental health care. I think there's less stigma than there was, and people seek out care. And I think that's really key because care has to be individualized as well as grounded in evidence-based medicine. And that's really the mission of Haven, to be able to provide a well-grounded treatment approach and also individualize that to the patient's needs.
Learn more today about Haven Behavioral Hospital of Eastern Pennsylvania, Reading's premier behavioral health hospital, providing the essential inpatient behavioral treatment adults and older adults deserve.